So I'm going to present my study that I began in 2020, last year, called Diagnostic Indicators of Insomnia in Community Dwelling Older Adults. It's a clinical accuracy study. I am Adriana Souza Szpalher, and my supervisors were Priscila Fradique de Souza and Carliara Weiss. I will begin with the background, and we know the world is close to the demographic milestone. People are becoming more older in every country in the world. We are experiencing growth in both the size and the proportion of older persons. The world is aging rapidly, both in Brazil and in other countries. In general, the older people are related with the high incidence of sleep illness. Older people typically present difficulties in initiate the sleep, more pronounced difficulty in keeping sleeping due to the constantly wakings and the prolonged daytime naps. With this, biological losses, social changes, such as roles previously played, and the need to face the loss of intimate relationships, in addition to performing new tasks caused by the loss of skills that were previously present in youth. One of the most problems with sleep in aging population is the insomnia. That is the important sleep deprivation. The insomnia is significant distress, results in significant distress in different areas of the individual's lives, such as academic areas, social, and it can last for more than 2 years. So insomnia is an important problem, health problem in aging population that we have to study about. So for this study, you used the nursing diagnosis insomnia that was approved in 2006, and it was reviewed last year in the last edition of NANDA. So insomnia is classified as inability to initiate or maintain sleep with impaired function. In the objectives of this study were to verify the structural validity of the nursing diagnosis insomnia, of the NANDA taxonomy in older people of community center, to identify the frequency of the defining characteristics and the related factors from nursing diagnosis insomnia, to verify the association between socio-demographic characteristics and the defining characteristics and the related factors of the nursing diagnosis insomnia, and to estimate the prevalence of the nursing diagnosis insomnia from the NANDA taxonomy in this population, the elderly population. So hypothesis was there are sets of representative clinical indicators of the nursing diagnosis insomnia from the NANDA taxonomy for older people of a community care center. So the methods were, it's a methodological study of diagnostic accuracy of the defining characteristics of the nursing diagnosis insomnia for structural validity in non-institutionalized older adults. Older adults that were not in hospital. 90 older adults aged 63 and 92 years old without cognitive or hearing impairment registered at the institution which promotes physical, social, and health activities were enrolled in this study. This institution was inside the Federal University. That was collected during phone interviews for each participant. The interviews were made in the phone because we are in the pandemic period. Specific instrument was performed for data collection containing socio-demographic data, defining characteristics and the related factors of the nursing diagnosis insomnia. So I represent the results. The table 1, demographic characteristics of the participants. Most was between 60 and 79 years old. Most were female, about 90%. Most studied until high school, 70%. 80% was widowed or divorced. 69% almost have had children, between 1 and 5 children. 61% lived with someone, some familiar, and 78% almost were retired. Continuing the results, the table 2 presents the associations between diagnostic indicators and socio-demographic variables. Few diagnostic indicators presented the association with the variables, as I am showing to you. I must emphasize that commonly demographic characteristics and the other clinical characteristics don't show statistical association with diagnostic indicators. Commonly, it's the results. So we can see that a few diagnostic indicators presented the association with the occupation, marital status, and cohabitors. And the table 3, there are the association between diagnostic indicators and the insomnia separate index, the ISI. It's a scale used to evaluate the insomnia in the people. So here we see that some diagnostic indicators such as altered affect, altered attention, altered mood, express dissatisfaction with quality of life, frequent naps during the day, dysfunctional sleep beliefs. With these results, we can see that this scale, this instrument, the ISI, it is important to evaluate both insomnia in older people in Brazil or in another country. So continue the results. The table 4 presents the associations between diagnostic indicators and socio-demographic variables. These tables shows the analysis of accuracy of defining characteristics of the nurse diagnosis insomnia in community dwelling older adults. We adopted the analysis of latent classes, which statistical method is a statistical method used to identify subgroups or categories of individuals, understood and allows the identification of response patterns based on observed characteristics relating them to a set of latent classes. Here, in this table, in these results, the sensitivity and specificity measures of the defining characteristics are presented after the model adjustment indices, which are significant in the analysis. In the present defining characteristics, the items are suitable for the model adopted through the latent class analysis. Here we can see the most presented sensitivity, such as altered affects, altered attention, early awakenings, and one presents height specificity that was insufficient physical endurance. The defining characteristics insufficient physical endurance presented height prevalence in the population, and the related factor average daily physical activity is less than recommended for age and gender, represented higher prevalence in this population. So in this table, we can see that this defining characteristics is appropriate to diagnose the insomnia in the older population. So implications of this study. These studies contribute by providing accurate clinical indicators of insomnia for the older population in order to assist in early diagnostic confirmation. It's also expected to contribute to recognition of precise indicators that help in the choice of nursing interventions aimed at clinical improvements. This study is a proposition of specific nurse interventions in promoting the assistance with quality and with accuracy for the aged population. This study can help nurses in the accurate identification of nurse and diagnosis insomnia in the aged population, which contributes to a clinical judgments. This is my principal reference, and I want to thank you.